Now, South Africa has recorded a significant rise in new COVID-19 infections, all in the past 24 hours. In the past day alone, over 4,000 cases were recorded for the first time since February the 2nd. The test positivity rate stands at 15.8%. Breaking it down provincially, the NICD says early warning indicators show an increase in Gauteng. The province recorded over 2,000 cases in a day, while the Northern Cape recorded the lowest with 37 infections. 65 deaths have been reported, 5 of them occurring in the past 24 to 48 hours. Now, this brings the overall death toll to 100,276. Joining me now to discuss the recent rise in numbers is Senior Lecturer Emeritus in the Department of Global Health at Stellenbosch University, Dr. Joe Barnes. Dr. Barnes, very good afternoon to you. Thank you so much for your time. A rise in COVID-19 numbers. What could be some of the contributing factors?
Good afternoon to you and to our viewers. There are numerous factors playing a role in the increase that you have just announced, and we have not yet identified an entirely new variant on the horizon, although that is always a possibility. But as far as I'm concerned, I think the single biggest driver of this upsurge in numbers is the fact that our winter has already started. And that tends to drive people indoors a lot more and in much more closer contact to one another. Seems to be still different subvariants of Omicron that are circulating. The pandemic hasn't gone away. But the numbers, even though they are dramatic, they've jumped up from a very low base. The test positivity rate that they reported for the previous reporting time was 15.8%, and the department usually starts taking only serious notice when it rises above 20. So we are still in the rising arm of this, and we don't yet know whether it is just going to be a sort of a relatively low peak or whether it's going to shoot up very high.
Is this evidence now enough for us to then conclude that we could possibly be experiencing a new wave of COVID-19?
There seems to be a consensus of opinion that we will see a new wave. How high and exactly when will depend on whether we get faced with a new variant to which many people don't have very well developed immunity, or whether it is the disease profile as we see it at the moment. If it stays as it is at the moment and nothing new comes in, then it will hopefully be much lower. The peak will be much lower. But if something new comes in, then we can expect a much, much higher peak. And that is why it's very difficult for us to forecast what the next month or two will look like, because the virus is a very sly enemy, and we don't exactly know what is going to be coming down on us.
How much can we gauge from what's happening outside of the country, like the US, the UK and China, when it comes to how the pandemic will affect South Africa, looking at those other countries?
You know, of course, if a new variant appears there and it starts spreading over the world, then we will not be spared. It will come here without a doubt. But we must also keep in mind that at the moment, these countries are at different points in the pandemic. You're mentioning countries in the Northern Hemisphere, and they're moving into summer now. So under usual circumstances, that is when the peaks, if they do occur, are much flatter. And it all depends on what is actually driving it. The other big role or factor is the vaccination status of such a country and the other rules and regulations that are in place, and they differ from country to country as well. In the places where, like the US, where there's a lot of disagreement in various states and various state governments and the central government, you're finding a scenario that's much worse because one state has got one set of rules and another state has got another, and they have a very large anti-vax movement as well. While in some other countries where, like New Zealand, which is in the same hemisphere as we are, things have been much more successfully managed. So comparisons are sometimes a bit difficult.
Mm-hmm. At the same time, all of this happens as South Africa plans to do away with the national state of disaster restrictions adopted in the wake of COVID-19. How influential will this latest batch of numbers be, or perhaps how much of an influence should it have on what government's next move should be?
At this stage of the pandemic, given that so many people have had a brush up against COVID-19 disease, and even though it's disappointingly low, we do have a certain section of the population that is fully vaccinated. The pandemic and the nature of it, and I must add to you, our knowledge of what works and what doesn't work has changed over the 2 years. And I don't think it is necessarily going to be totally disastrous to change into what we are changing in. We need to just remind or encourage the population to come forward and not only get vaccinated but take their booster shots. I'm really concerned that has almost fallen off the agenda in many places. Here where I live, a large number of the vaccination stations have closed. So we are not making it easy for people to do that. So I'm hoping that with common sense and encouraging people, if you feel you are particularly vulnerable, you are old, you suffer from asthma, or you have other immune system disease on board, wear a mask and protect yourself with common sense.
Some sound advice. Thank you so much. Let's leave it there for now. Dr. Joe Barnes, Senior Lecturer Emeritus at Stellenbosch University's Department of Global Health, speaking to the latest confirmed cases of COVID-19 in South Africa at around 4,406 new infections.